WTIM.
Welcome to the WTIM Morning Show. I'm Avery Cooper. Your stream on TaylorvilleDailyNews.com's Facebook and on YouTube at WTIM TV. Brought to you by Landmark of Taylorville, where you always do better with Landmark. And People's Bank and Trust. They put people first. I'm here on the phone with Pana Community Hospital nurse Twyla Baumgartner. Great to have you along, Twyla.
Great to be here. Thank you.
I also have marketing manager Melissa Reibold on the phone. We'll talk with her here in a moment. First, though, I know that you're a nurse, obviously, and you do a lot with Medicare wellness. So tell me, what is a Medicare wellness visit, Twyla?
Well, Medicare Wellness Visit is basically where we go through your chart, we look at your family history, we look at your medical conditions, your prescriptions. We try to put together a list of risk factors and screenings that are available to you.
How is a Medicare wellness visit different from, say, a regular checkup with my physician?
Wellness exams mainly focus on like prevention and early detection, different from a regular visit where you're usually there to talk to the doctor about a specific problem. We try to find things early to prevent something worse later on down the road. We try to make a checklist according to your diagnosis, according to your family history individually. So you can go home with a list of what you need, what's going to be 6 months down the road, a year from now, to keep you healthy.
How often should you have these Medicare wellness visits?
Every 12 months. Medicare will cover that every 12 months.
Okay. So the way I'm understanding this so far is that Medicare wellness visits are kind of a lot like a regular visit, but under the stipulations of Medicare and etc. Do I have that right, or am I off on the wrong track here?
Yes.
Okay. What is the I mean, if you're on Medicare, I would assume that it's free, right?
Yes. Every 12 months, they will pay for a Medicare wellness visit. There are a lot of screenings that Medicare will cover at 100% that a lot of people are not aware of. We go through those screenings depending on, your family history, your current health conditions. So it's individualized.
And I suppose that is a big benefit of having these Medicare wellness visits as well, that they're personalized to and tailored individually to each patient.
Yes. We'll go through, we take our time. When the patient comes in, we go through their chart. We, get information if they see another specialist somewhere. Sometimes we don't always get those notes from the cardiologist or the pulmonologist, so we gather all of that information when they're in there, so we can get all of that into their chart, and work with their primary doctor, to make sure that they have the screenings that they need according to their specific diagnosis.
What should someone with Medicare know about scheduling an appointment with Pana Community Hospital when they have Medicare for these wellness visits?
Pana Medical Group, I do them at Pana Medical Group. Deb Anklem does them at Community Medical Clinic. So you just call, whoever your primary provider is, just call the clinic and say you want to schedule a Medicare well visit. We'll make sure that you are due for one, and then we'll just put you on the schedule and get it done.
What kind of things are you looking for when you go through these Medicare wellness visits? I know family history, you look at other stuff, but I mean, when you're going through that sort of checklist, right? What are some of the things that you're really paying attention to?
So far, we've been doing these for, a year, a little more, but we've really been trying to, do more of them the last year. Like colon cancer, there are different screenings. Colonoscopies are good, but there are different screenings for colon cancer if someone does not want a colonoscopy. So we can, let people know what those are. Bone density studies. We check cholesterol, mammograms for women, prostate. There's a blood test for prostate cancer. We've actually caught very early prostate cancer doing these. And then, we go through their immunizations also. So if they're due for a pneumonia shot, a flu shot, we let them know what they're due for. A lot of people just need to know, okay, what do I need to do and when? And that's what we help them with.
What kind of well, actually, let's back up just a moment. How often should someone check themselves for or cancer or other types of diseases such as, I guess, cancer?
Well, depending on family history, for one thing, depending on, what they have as a diagnosis, that's what these do. We look at their chart, we look at them individually and go from there. Medicare will cover, for example, an abdominal aortic aneurysm screening for men who have ever smoked so many cigarettes in their lifetime. It could have been 40 years ago, but a lot of people don't know that screening's out there. They'll cover that once in a lifetime. Colonoscopies and different colon cancer screenings, are depending on, if your mother or your father had colon cancer, or if you have certain symptoms. You look at that individually, and Medicare covers it individually like that if you have these things in your family. So we try to, let each person know what Medicare will cover for them.
What kind of vaccinations will you go over with a patient on a Medicare wellness visit?
Well, flu shot, of course, every year. There are 2 pneumonia vaccines that Medicare covers once you're 65. We tell them if they need that and when they should get it. The COVID vaccine, tetanus vaccine, Shingrix is a shingles vaccine. Medicare does not cover every vaccine, but we always let the patient know which ones they do cover. They always cover a flu shot, and they always cover the 2 pneumonia shots and the COVID vaccine.
What about anytime I don't know, maybe I have a certain ailment that I need fixed? I don't know what that might be, but let's just say something's bothering me, and it's something that I would normally go to a regular doctor for, but I'm on Medicare. Is that something that a Medicare wellness visit can cover?
So a Medicare wellness visit is more about wellness, like keeping you healthy down the road, checking your cholesterol, making sure that we give you, guideline of what to eat to keep your cholesterol down. If you need something addressed, that is a separate visit with your physician.
Okay. Is there anything else that you'd like to say, Twyla, about Medicare wellness visits? Very informative. Yeah, I guess I'd just like to give you a chance to maybe cover something I didn't get to, or maybe if you'd like to recap, the floor is yours.
So, if you have not had a Medicare wellness visit, you can call, the clinic, community medical clinic or Pana Medical Group to schedule it. Just tell them that you would like to schedule your Medicare wellness visit. Once you come in for your visit, we go through everything. We give you a care plan that you will go home with. It's your to-do list. We can order all of those tests during your Medicare wellness visit, what you qualify for. Then that goes to Pana Hospital or wherever. If you don't go to Pana Hospital for certain things, we can order it wherever you want. And then we get those scheduled. The results go right back to your physician, and then your physician will, take it from there with the results.
Anything else Nurse Baumgartner.
Nope, I think that's all.
All right. Thank you so much. That is Nurse Twyla Baumgartner with Pana Community Hospital. We'll hear from Marketing Manager Melissa Reibold about some of the new events happening with Pana Community Hospital and the growing physician clinics here on the WTIM Morning Show. Your stream brought to you by Landmark of Taylorville, where you always do better with Landmark, and People's Bank and Trust, where they put people first. More after this short break right here on WTIM, your information station.
WTIM. Hello, I'm Dick Adams, the new Executive Director of the Christian County Economic Development Corporation. From helping Taylorville and Pana establish and promote their industrial parks to constant communication with existing and prospective employers, our ongoing work has helped grow and attract many businesses. Funding comes from both public and private sources and is vital to continuing our work toward attracting more jobs. Find out more online at christiancountyedc.org.
This announcement donated by the Miller Media Group.
Operation Loaded Book Bag is on. The Christian County YMCA, in collaboration with Taylorville Memorial Hospital and Dinner Season with Love, will be collecting school supplies from August 1st through the 31st. If you bring in a bag of school supplies, the Christian County Y will waive your activation fee for new members. Supply lists can be found by going to www.ccymca.org. The Y for youth development, for healthy living, for social responsibility.
Taylorville Care Center, Taylorville's premier nursing facility, is hiring, and they're offering the best opportunities in town with new wages, elite pay, and premium pay programs for RNs, LPNs, and CNAs. Nurses may be eligible for major medical insurance if qualified as a level 2 nurse. Their exclusive work perks has something for all employees. Quarterly retention bonuses and weekly vaccination incentives are also offered. Apply to learn more. Join the Taylorville Care Center family by finding their ad on Indeed.com. Taylorville Care Center, caring for the community for nearly 50 years.
I'm Will Perkins, President and CEO of the Taylorville Community Credit Union. TCCU is proud to be the exclusive sponsor of the Miller Media Group Community Spotlight, allowing a different nonprofit organization to be highlighted on WTIM, WMKR, and WRAN each month.
I'm Amy Hagan, co-coordinator at the Taylorville Food Pantry. During these tough economic times, as the cost of living has increased to a level not seen for many decades, the Taylorville Food Pantry continues working in Christian County to keep our families fed. This time of year, garden produce is welcome. Consider sharing your abundance with us. For more information on hours, donating, or volunteering, please visit us at TaylorvilleFoodPantry.com or visit us on Facebook. Taylorville Food Pantry, feeding hunger with heart.
This is Cammie Payne, General Manager of the Miller Media Group. We, along with TCCU, are proud to bring you the Community Spotlight each month.
TCCU is proud to be the exclusive sponsor of the Miller Media Group Community Spotlight. Come join us. You'll wonder why you waited. Member NCUA.
Jim Stepp, owner of Central Illinois Asphalt in Taylorville, helps protect your driveway or parking lot with recycled asphalt and environmentally friendly sealer. Let his 40 years of experience work for you at a reasonable price. Click his icon at TaylorvilleDailyNews.com.
The Shelby County Economic Development Corporation aims to foster, promote, and stimulate economic development. They're here to help your business grow. Find out more on the Shelby County Economic Development Corporation by clicking their icon at TaylorvilleDailyNews.com.
Your information station. WTIM.
Welcome back to the WTIM Morning Show. I'm Avery Cooper. Your stream on TaylorvilleDailyNews.com's Facebook and WTIM TV YouTube, brought to you by Landmark of Taylorville, where you always do better with Landmark, and People's Bank and Trust, where they put people first. I'm here on the phone with Pana Community Hospital Marketing Manager Melissa Reibold. Great to have you here, Melissa.
Thanks for having me, Avery.
So I understand Pana Community Hospital is growing its family of physician clinics.
Yes, Pana Community Hospital has recently announced that it has acquired a new physician practice. We have acquired the Cowden Medical Clinic, which is located in Cowden, and it's something that we're really excited about. We have 6 clinics now with this one. Pana Community Hospital has the Pana Community Medical Clinic. We have the Pana Medical Group. So we have 2 clinics in Pana. We have a clinic in Assumption. We have 2 clinics in Nokomis, the Nokomis Medical Group and the Community Medical Clinic of Nokomis. We have the Ramsey one and the Ramsey Medical Group in Ramsey, and now Cowden. So we're real excited to be expanding.
What will Cowden offer you that you may not have already had?
Well, first of all, the Cowden Medical Clinic is a clinic that has been owned and operated by Cindy Rich, who is a nurse practitioner from the Cowden-Herrick area. And Cindy has owned that practice since 2006. And her and her staff there in Cowden have provided excellent medical care to the people in that area. And Cindy was actively looking for an organization to purchase and oversee her clinic, so she could maybe step down a little bit from the administrative role and still work actively as a nurse practitioner with her patients. So Cindy was talking with Pana Community Hospital, and we just felt that it was a really good fit for both the hospital and Cindy and her patients in Cowden. So, as of August 1st, we have settled with, acquiring that particular clinic. But I want to let all the listeners know that really from the outside, the clinic is going to be exactly the same. Cindy Rich and Kelsey West are the 2 nurse practitioners that work at that clinic. They're still going to be working there. They still have their same staff. So really the only thing we're doing is kind of taking more of a back-end executive role, overseeing the operations, the billing, some of that stuff that was harder for them to handle on a day-to-day basis.
That clinic, more so of a wellness visit type clinic or a primary care provider, or what are we talking here? Is there a specialty?
Yeah, it's just like, I guess you would call it a doctor's office, a physician's office. They have a very large patient base in the Cowden and the Herrick and the Beecher City. That particular clientele down there, they have a very, very loyal following. And Cindy has been an excellent provider to the people of that area, and that will continue. And you can go there for a doctor's visit, just like going to see your primary care physician. There is a primary care physician, since Cindy is a nurse practitioner. There is a primary care physician that kind of oversees that, and that would be Dr. Marlon Unesis is going to, oversee the practice as a physician. But really, everything is going to be the same there in that clinic.
Anything else that you would like to say about your addition of the Cowden Medical Clinic to the Pana Community Hospital, Pana Medical Group?
Just that we're really excited that, we'll be able to expand our care a little bit more south than what we're currently doing. And we are just going to, hopefully, in the next few months, our executive team is going to be in the Cowden area, getting to know some of Cindy's local patients, getting to know the community a little bit better. And it just makes our hospital stronger when we have just one more rural clinic that we can help those patients in that area.
Melissa, we got to go here in a moment. Wanted to give you a chance to go over something maybe I didn't get to.
That's pretty much it. We got a big golf outing coming up in September 2nd. And the money from that is going to go to our new in-house MRI at Pana Community Hospital. Is very excited. A building is going on right now for that MRI, and we hope to be able to have that in service this fall. So a lot of great things happening for our hospital and our physician clinics.
That's marketing manager for Pana Community Hospital, Melissa Reibold. Thank you so much for taking time out of your day to come on the WTIM Morning Show.
Thanks for having us.
Your stream brought to you by Landmark of Taylorville, where you always do better with Landmark, and People's Bank and Trust, where they put people first. You can find those streams on the TaylorvilleDailyNews.com Facebook or on YouTube at WTIM TV.
WTIM. With SRN News, I'm Rich Thomason.